Hey guys, I'm here at Skin with Dr. Hoffman. We are talking about acne. Acne affects a lot of people, from babies, adolescents, and even some adults. So this is such a big topic. What advice do you have for folks, like even with a newborn, like with baby acne?
Right, so acne can affect all ages. In adolescence, it's almost universal. Of course, severity will be different for different kids. Baby acne, not so rare too. And in most cases, it doesn't need to be treated. It's transient. It's from hormones that are exposed to by the mother while still pregnant, and so that can show up with a little bit of acne that usually isn't there the day that the baby's born, but it may show up a few weeks after and last a couple of months. If you're not sure about it, absolutely you can bring it to dermatologist or your doctor to get it looked at, but that usually goes away on its own without any need for any treatment.
Excellent. So with adolescents, that's a little bit trickier. What would you suggest people do with their little kiddos?
Yeah, so I would say for most people, if there's a significant acne issue, you don't want to wait too long to get it checked out. There's a few different over-the-counter treatments, and I can name some of them, which can be quite helpful for very mild acne, and some people will get what they need just from that. But if you are having pustules, painful areas, deeper areas, any signs of scarring that they're healing with any divoting in the skin, then you really don't want to wait. The over-the-counter treatments are not going to be enough to really get you better and to really avoid scarring and get things under control. You really should come in and be seen. That's not that everyone needs prescription treatment, but if you wait too long, then sometimes there can be more scarring, and that's something you want to try to avoid.
For sure. And it's already tough growing up, let alone with acne. So what about the adults that have acne?
Mm-hmm.
What advice do you have for them?
Yeah, so it is kind of a misconception that it's just for teenagers and everyone's going to outgrow it, while it is percentage-wise a little bit more common in teenagers, especially for women. It is a lot more common. Men can have adult acne too, and there's all kinds of great treatments there. But there's a hormonal form of acne which is particularly prevalent with adult women, and without the right treatment, it can be often a chronic condition all the way up until menopause.
Wow.
There's some overlap with the treatments we use in teenagers, but there's also some other agents, some oral medications that we sometimes use, which are extremely helpful specifically for adult female acne. One in particular is spironolactone that we use a lot and can see very consistently good results in adult female acne. So it's not something you have to live with. It's also not something that's going to go away on its own. And usually prescription strength treatment is needed for adult female acne. So if you're suffering from this and don't know what to do, I wouldn't necessarily wait. Time is probably not going to cure it.
Thank you so much, Dr. Hoffman. That was very informative. And I am 31 and I still have acne. So I'm one of the many that have adult acne. So don't be afraid. It's okay.
If you don't have the right treatment plan yet, although your skin looks very nice today, come on in and we can see what you might need.
So Dr. Hoffman, you were telling me something very interesting about why acne is treated under insurance.
Yes, acne for a long time now is considered a medical condition, really not just or not at all a cosmetic condition. One of the key reasons is they overlapping with real mental health problems. People that suffer from acne will very often suffer from depression, anxiety, social phobia, and it's incredibly common and not something ever to feel ashamed of, and a very valid reason to seek out treatment for one's acne, both to help clear the skin, but also to help with a sense of well-being and improve mental health.
Thank you for having us, and thank you for all that useful information as well.
You're most welcome.